sure all of you will get a kick out of this. You might laugh, and then you'll probably be upset afterwards. Pertaining to emergency room visits in Austin, Texas. Get a load of this. In the past 6 years, 8 people from Austin and 1 from Luling, Texas, racked up 2,678 emergency room visits in Central Texas. The last 6 years, 9 people racked up 2,678 emergency room visits in Central Texas, costing taxpayers, hospitals, and others $3 million, according to a report from a nonprofit made up of hospitals and other providers that care for the uninsured and low-income Central Texans. One of the 9 spent more than a third of last year in the ER, 145 days. That same patient totaled 554 ER visits from 2003 through 2008. This is ridiculous. The report that mentioned the 9 high-frequency patients didn't include reasons for all those ER visits and didn't identify the patients because of privacy laws. But a former state legislator, his last name was Kitchen, I forget his first name. It's in there. I'll have the link off the right side. He said this about these 9 people. All 9 speak English, 3 are homeless, 5 are women whose average age is 40, and 4 are men whose average age is 50. 7 have a mental health diagnosis, and 8 have a drug abuse diagnosis. Kitchen said she did not know their citizenship status. Kitchen estimated that each ER visit averaged about $1,000. The cost represents a national average for all ER patients, said Anjum Khurshid, the ICC's Director of Clinical Research and Evaluation and a co-author of that report I'm quoting from. The ICC, whose mission is to work with safety net providers to improve access to and quality of healthcare, has a database of 750,000 uninsured and underinsured Central Texas patients collected from its members. That database is confidential because of patient privacy laws. It found that 900 frequent users, people who visited an ER 6 or more times in 3 months, had 2,123 preventable visits in 2007 alone, or 18% of 11,600 total visits to Central Texas emergency rooms, which cost more than $2 million. Among those picking up the bill were hospitals and taxpayers, including government programs such as Medicare and Medicaid. I'm not saying these 9 people speak for everyone, and I'm not saying, that's such a small sample, but I think this does, say something about our culture when you've got idiots visiting the emergency room. Nobody visits the emergency room. What was it? This one idiot. It's ridiculous. Nobody visits the emergency room that many times unless you've got some severe. I'm at a loss for words. I've been to the emergency room once in my life, so I think a lot of this goes back. These people are on government programs which are inefficient and costly, and they're going to the ER when they don't need to go to the ER. And then looking at 8 of them have a drug abuse diagnosis, and 7 of them have a so-called mental health diagnosis. I'm not going to get into that, but they brought a lot of it on themselves. 8 have a drug abuse diagnosis, so I'm not saying just throw them out in the street and let them die, but there's a thing called personal responsibility. If you get into drugs, and this is why I wouldn't go as far to legalize all drugs, even though I don't believe protecting people from themselves is a good idea. I would legalize marijuana as an aside. No, I'm not going to get into why, but people have to be responsible for themselves, and this culture here, they're just abusing it, and it's costing us big. So there's some food for thought, and I thought it was outrageous.